Hi, it's Dr. Brian Taggy and welcome to the ENT Minute. Today we're going to talk about an advancement in technology that has improved the outcome in the treatment of chronic sinusitis. Today we're going to talk about balloon sinuplasty. This is a wonderful advancement because now we have the opportunity to treat individuals with chronic sinus infections or individuals that have these recurring infections that causes them to come in and see us in the ENT office. So what is balloon sinuplasty? I think everyone has heard about endoscopic sinus surgery, which is the modality that we've been using over the past 30 years. And in the 1990s, we came out with these endoscopes. And I think everyone has heard about endoscopes. And so the standard treatment for chronic sinusitis, individuals that keep getting these infections over and over, requiring multiple courses of antibiotics and treatments, the reason that individuals need these interventions is because of the blockage of the sinus. Here's the principle. If a sinus becomes blocked, every sinus cavity has a little opening, and we call that an ostia, O-S-T-I-A. And these little openings can become permanently blocked. And when they become blocked, there's less oxygen infiltrating into that cavity. And when there's less oxygen, the pH drops. And when the pH drops, then that's a setup for recurring infections. And so the key feature is the blockage of the sinus. And so what does a balloon do? And why are we using balloons now in our recommendations to our patients? So let's look at that. So the treatment is for chronic sinusitis. Now, that's a term that we use that is diagnosed based on your interaction with your ENT physician. We first take a really detailed history of how many infections you've had over a year period of time. How many antibiotics are you taking? Are you using decongestants and other medicines in addition to the antibiotics? And so the history plus the physical examination, and oftentimes we'll use these endoscopes again, these cameras that we put inside the nose that analyzes the sinus areas. And so very important part of the examination. Now, the third and maybe the most critical part of the evaluation to determine if this is someone we can help via surgery or these balloons is the CT scan. And so we get a CT scan, we're looking for individuals that have this permanently blocked opening or ostia. And so that's the term that we use. And so if we make that decision that you have a permanently blocked ostia, then you may be a candidate for balloon sinuplasty. And so what is the balloon sinuplasty? When we go in a standard surgery for chronic sinusitis, the standard is to go in and make these openings by removing tissue. And we use instruments that are called microdebriders. And these are instruments where we remove that tissue around these openings to create that ventilation, the flow of oxygen. And so if we make a determination in the office that one is a candidate for balloon sinuplasty, and one critical component of that is as long as you don't have polyps or cysts or tumors that are blocking the sinuses, then you may be a good candidate for balloon sinuplasty. Now, why is that important? The reason is you can do this, and a lot of people love to hear this, you can do this without going to the operating room. You can do it right there in the office. And so patients will come in and have their procedure done and leave the office and go home and sometimes go back to work and resume some normal function. And that's a great part of this technology in advancing this because it becomes minimally invasive is the term that we use. And so it becomes an office procedure. You can also do it in the operating room in conjunction with endoscopic sinus surgery. When we use these balloons, we use data that's obtained from the CT scan that your doctor is going to order, and that scan is then fed into the instrument tip so that we properly identify precisely where that balloon is going. Again, we want that balloon right in that opening where you're supposed to have the opening to spread open that ostia or the opening. And so we use navigational equipment. That's this CAT scan that's used in conjunction with the balloon. So why is this advantageous? The technology is wonderful and it makes a difference if you're a candidate via the history exam and CT scan because it's minimally invasive. We're not removing or debriding or excising the tissue from the sinuses. And so there's less bleeding. Faster recovery times. People love this. Like I said, if you have the surgery, there's recovery involved and days missed at work. With balloon sinuplasty, sometimes you miss one day and go back the next day. Less pain. And people are always excited to hear about this one because there's way less pain after a balloon sinuplasty, especially if you're doing it in the office. Has a high success rate. This has been proven. It's been around for more than a decade now. And the success rates have been proven. People are always asking me, does this last forever? That's a common question. And the answer is yes. Studies show that there's excellent results in terms of long-term benefit from balloon sinuplasty. A high success rate. You're preserving the natural anatomy of the sinuses. And so it's interesting. I've even had people come in and I'll look with my camera or I'll do a CT scan and they've had previous balloon sinuplasty and the anatomy still looks normal. After looking at anatomy on a CT scan from someone that has had sinus surgery, the anatomy is a little distorted and different. And so that's an advantage as well. It's very low risk because of the guidance that you get from the CT scan into the instrument, knowing exactly where you are precisely to the millimeter. Very low risk for balloon sinuplasty. This can be done awake. Now, sometimes I'll give a sedative like a Valium, but many patients, at least half of my patients, won't even receive Valium. We do anesthetize the nose, meaning we numb it up just a little bit. There's a little injection that we put into the area that's well tolerated, but it can be done in a completely awake state as we're talking to the patients as we're doing this. There's a little bit of pressure. There's a tiny amount of pain, but it's tolerated well in my experience. And then lastly, as I said earlier, you can do this combined with other procedures. What a wonderful technology we have now to treat individuals with chronic sinus problems. And this may be something that you're a candidate for, something it's worth talking to your ENT physician. Thank you for joining us today. Make sure you hit like and subscribe, and we'll see you next time on the ENT Minute.